Hi, my name is Angelique Montano-Bresolin. I'm a pelvic health physiotherapist, and today we're going to talk about the common symptoms and treatment for menopause. So, what are some common symptoms that arise during menopause? There are some global symptoms, some systemic symptoms that will start to creep up on women, and others are more local to the pelvis with regards to vaginal health. So, if we're looking at global, more systemic symptoms of menopause, we are talking about things such as night sweats, hot flashes. Some women experience significant amount of fatigue, and sometimes this fatigue is enhanced as a result of some disruptions in sleep patterns. So these hormonal fluctuations can actually create this disruption in sleep patterns. Some people really struggle with falling asleep, and then others will struggle with staying asleep. In addition, there can be some aches and pains that occur in the joints of the body, but there can also be some skin changes, so changes in color and texture. Again, dryness in the skin is very common. And we're not just talking about skin through our face and our arms and our legs, but also skin more local to the pelvic area, so in that vulvovaginal area. With regards to mental health, there can be mood swings that are associated with menopause, as well as memory changes and memory issues. So some people will start to feel like they become more forgetful and they can't recall short-term things that they've done, or short-term memory loss can be a concern as well. And of course, as I mentioned earlier, vaginal health and changes in vaginal health is a real big piece with menopause.